Next, I'd like to introduce Denise Milne. Denise is a senior manager in Alberta Human Services, and her current portfolio is lead of the provincial FASD initiative. She has several master's degrees in clinical social work, healthcare administration, and counseling psychology. And she's currently working on her dissertation for her PhD in psychology. Denise has taught at the Faculty of Social Work at the University of Calgary. Welcome, Denise.
Thank you. So thank you very much for the opportunity to present. I'm going to share with you where we are in Alberta in terms of prevention. It is a shared responsibility that is throughout our 10-year strategic plan. So I'm just going to quickly give you the context of Alberta in terms of the background of the FASD initiative, a little bit about the cross-ministry. That's a huge piece of collaboration in the network program, the results of our recent 5-year evaluation, and where we're going next with our prevention strategy. So very quickly, obviously FASD has had a huge history in Alberta. But what's significant here is we established the Cross-Ministry Committee in 2003. We developed a FASD 10-year strategic plan, which was released in 2007, and we are now in year 6 of that plan. We were approved by Cabinet at that time for $43 million. We are sitting at $16.5 million, which a large chunk goes to prevention. We initially started out with 7 FASD service networks. We're now up to 12 to accommodate the whole province. Our cross-ministry membership obviously is made up of 6 ministries as well as Alberta Gaming and Liquor Commission. They have a recent campaign that they've done that has created quite the conversation, and we are evaluating that as well as we have ad hoc membership from Alberta Health Services, First Nations and Inuit Health, PHAC, Safe Communities. They are critical players to us. So it's very much a collaborative effort, and that certainly came through in our Year 5 evaluation. Under the 10-year strategic plan, we have a number of strategic pillars that we're looking at: prevention and awareness, assessment and diagnosis, supports for individuals and caregivers. Those 3 categories fall within the FASD service network program, so the 12 networks. And then the other activities of training, education, strategic planning, research and evaluation, and stakeholder engagement fall with the Cross-Ministry Committee. So our service network program, as I said, there are 12 across the province, including Métis. Their vision is to have a very coordinated and comprehensive response to support individuals across their lifespan living with or suspected of having FASD as well as their caregivers. So it's a single point of access for us. They do awareness in local communities, albeit they don't get a lot of money for that. They do prevention through mentoring, and PCAP is a huge program for us. They also do assessment and diagnosis, so 14 out of the 25 clinics are funded by the networks. They do supports for individuals affected, supports for the caregivers, and again, across the lifespan. This is the map of the network program, and again, I'd like to highlight the Métis settlements, 4 on the east and 4 on the west side. And all the coordinators work collaboratively with each other and with cross-ministry, and they're part of our strategic and operational planning. So we recently had a Year 5 evaluation, and really it was to look at our progress since the implementation of the 10-year plan, really to look at the progress that's been made, continuous improvement, and also to help us with Year 7 and Year 10 evaluation. We have now moved into Year 7 evaluation. So there's 2 areas I want to highlight for you. One is around awareness. So the outcome was Albertans will understand that alcohol use during pregnancy can lead to FASD, that FASD can be prevented, and FASD prevention is a shared responsibility. Through the Population and Health Lab at the University of Alberta, they surveyed 1,200 people plus. Obviously a lot knew about FASD, but the significant piece to this very quick survey that occurred, 40% knew someone with FASD or knew someone that was a caregiver. And that's pretty significant, I think, even though it was around 1,200 people. The other piece, we recently had some training with judges. There was about 20 judges that were trained on FASD. 4 of them self-disclosed that they knew someone with FASD that was caregiving that individual. So that's pretty significant as well. So people are beginning to talk more and more about FASD in Alberta. In terms of prevention, we looked at alcohol use during pregnancy is eliminated, significant, aspirational. So the proxy measure was used looking at the PCAP programs, and as you know, there's about 24 of them in Alberta, 7 of which are First Nations. We really wanted to look at how they were operating. So we've increased our funded PCAP programs from, in 2008, there were 4, network funded up to 18. The rest also get funding from other places such as Alberta Health Services. What you're seeing is an increase in clients participating in PCAP programs. In the work that was done, 59% were Aboriginal, 20% were Caucasian. The trends are significant, I believe. What we found was there was increase in employment for these women, decrease in welfare use, and increase in the use of birth control. As a result, we have a number of councils within the cross-ministry committee, and one happens to be now the Awareness and Prevention Council, which Nancy Poole has graciously agreed to co-chair with myself, and it has multiple members in that particular council. And really it's to look at addressing alcohol use during pregnancy, that whole particular strategy within the plan. We're looking at the first and second levels of the 4-part model in terms of broad awareness and the discussion of alcohol use. We want to be able to involve stakeholders and again look at how we can link it back to the cross-ministry committee. So in this 2-phased approach that Alberta is taking, we've attached $1.25 million, so not a lot of money. The first amount of money has rolled out to the South Network. So we're looking at a literature review, key messages, awareness and prevention tools, which we have a number of already and will continue to develop more. And then each network essentially will get a sum of money to hire a prevention facilitator to work with community. And that's it in a nutshell.